we know that approximately 25% of the chest pain presentations to ERs are due to panic attacks. But what about the other 75%?
Yeah,
right. So you don't want to be the one who is deciding whether you're the 1 out of 4.
Welcome to Baptist Health Talk, a podcast on all things healthcare, powered by Baptist Health South Florida, your trusted source for healthcare prevention and wellness.
I'm your host, Neki Mohan. Welcome back to a new episode of Baptist Health Talk, where we answer your most searched questions on trending topics. Today, we're talking about the science behind panic attacks. We'll unpack what's really going on beneath the surface and how to better understand and manage what your body may be trying to tell you. We are joined by Dr. Rachel Rohaidy, psychiatrist at Baptist Health Miami Neuroscience Institute, and Dr. Dapo, also known as Dr. Dapo, preventive cardiologist at Baptist Health Miami Cardiac and Vascular Institute. Thank you both for being here. Let's dive right in. To Dr. Rohaidy, we're going to start at the root. What happens in your body and happens in your brain during a panic attack, and why does it trigger such a response?
Oh, that's a really good question. So, and I know this is a really important topic because being a psychiatrist, I have a lot of new patients coming in with panic attacks. And so what happens is almost a neurochemical imbalance, right? And so we have different parts of the brain always talking to each other. And we see this disbalance between what we consider the amygdala, right? Which is inside of one of the inner structures of the brain, and the brain stem really firing, and our kind of prefrontal, our frontal cortex not firing as much. And they've been able to actually see this using functional MRI. You see an increase in one area, a decrease in a different area. And so this neurochemical imbalance at this moment isn't just in that area, right? So we're not different pieces. Our entire body works in conjunction. So we've also got some neuroendocrine things happening at the time of a panic attack. So we have, things like norepinephrine shooting up, adrenaline shooting up. And so all of that is kind of, I want to use the word dysfunctional, but it's not dysfunctional, is heightened in the body at the time of a panic attack. So we have real physiological changes happening.
Yeah, it can be quite scary.
Yes.
To Dr. Dapo, from a physical perspective, what happens to the heart during a panic attack? What systems are activated and what symptoms show up?
Yeah, so another good question. Essentially, when you have this neurocognitive imbalance, as Dr. Rohaidy mentioned, this activates something called the sympathetic nervous system. And so your sympathetic nervous system, if you like to conceptualize that, it's your fight or flight response. And so with that, you get an increase in adrenaline, noradrenaline, and this then affects your blood vessels, your blood pressure, your heart rate. So we oftentimes will see an increase in the pulse, and then we'll see a concomitant increase in the blood pressure as the vessels constrict from that adrenaline. This can cause a multitude of symptoms. So people can feel palpitations, they can feel short of breath due to hyperventilation. They can feel chest pain, and oftentimes the chest pain mimics that of cardiac chest pain. So they can feel central chest pain. It may move to the arm or the jaw. They can feel sweating, cold and clammy, numbness and tingling in the hands and feet. These are all secondary to this increased surge of sympathetic tone or adrenaline in the body.
Yeah. Dr. Rohaidy, now heart attacks and panic attacks can feel eerily similar, right?
Mm-hmm.
What are the key differences between them, and what should someone look for in the moment to decipher, am I having a panic attack? Am I having a heart attack?
Yeah.
Maybe I'm having both.
So though I love this question, it is a very complicated question because it's so individualized. Everyone feels something different. And so I think, Usually you have the common symptoms of this heart attack where it's radiating from an arm, right? Or from the jaw and it's going towards the heart. And in a panic attack, it could be a very precise point of pain that they feel, not necessarily a radiating pain. You've got kind of the similar symptoms, right? So in a heart attack, people can have dizziness, nausea, vomiting, palpitations. In a panic attack, you may or may not have similar symptoms. You also have that fear of losing control, the fear of dying, what I hear a lot of when patients have panic attacks. And then you look at the duration. So, and how fast this comes on. Usually with a heart attack, it's gradual. Sometimes with a panic attack, it can happen from one moment to the next. There's not a gradual uptick. And then there's alleviating factors, right? So with a heart attack, you've got certain medications that help, like nitroglycerin. I'm not a cardiologist, so I'm sure things have changed since I went. And then, in a panic attack, it can be breathing exercises and meditation, which can bring down the symptoms. But regardless of either one, if you feel like you're having a heart attack, you need to go to the emergency room.
Dr. Dapo, do you want to weigh in?
Yeah, no, I think the last thing you said there is key is, if you feel these symptoms, it's not your job to determine whether it's a panic attack or a heart attack.
Yeah.
You should go see a professional and preferably the ER.
Mm-hmm.
We know that approximately 25% of the chest pain presentations to ERs are due to panic attacks. But what about the other 75%?
Yeah.
Right. So, you don't want to be the one who is deciding whether you're the 1 out of 4 that's having a panic attack. So I think that's really important. And a lot of the symptoms overlap. From a cardiovascular perspective, we don't pretend to know which one is going on. We have a hunch one way or another, but we always confirm first. And that includes diagnostic testing, et cetera.
Absolutely.
I think we may go into that later.
Yeah.
But.
What's physiologic? What physiologically makes them so hard to distinguish?
Yeah. So, when someone's having a heart attack, there's a coronary artery that's blocked, and there's a decrease in oxygen to a part of the heart. And so this causes chest pain. It can cause shortness of breath. It can cause sweating. As long as that artery is blocked, the person is going to continue to get worse and their symptoms may get worse. With a panic attack, there's no decrease in circulation or blood flow. In fact, there may be an increase in circulation or output of the heart, but they share the same pain receptors.
Mm-hmm.
So when someone's having a heart attack and someone's having a panic attack, their pain may be almost identical, but the physiologic basis for that pain is different.
So what about your blood pressure? Would it show up in blood pressure? Is your blood pressure elevated in either way? Does it present the same way?
In both situations, you can have high blood pressure. Sometimes with big heart attacks, occasionally people will have eventually low blood pressure. But most of the time, when you're feeling pain, that's also triggering your fight or flight or your sympathetic tone. And so your blood pressure is going to be higher. Your pulse is going to be higher. And that blood pressure is very different than what we would call hypertension. So I always use the example, if I end up in the ER, my blood pressure is high, but my leg is broken, don't give me blood pressure medication, fix my leg, and my blood pressure will come down. So really getting to the root cause of what we see on those diagnostic tests is important, and that can happen in the ER, it can happen in a cardiology office, or it can happen in a psychiatrist's office.
Oh, very good stuff. As a psychiatrist, Dr. Rohaidy, how do you go about diagnosing and treating panic attacks? And can they be cured or just managed?
Well, that's a really good question. I get that a lot from patients. Will I ever be cured of this? And so starting off your evaluation is just a very good clinical interview, right? So getting medical history, family history, getting a good substance use history, just getting a good history to figure out where this is coming from, how often it happened, and when it happens, what does it look like? Because everyone can say a panic attack or anxiety attack, but they may mean slightly different things. And so really getting a thorough history is number one. Right. And then, of course, we diagnose using our DSM-5 now that we're using our diagnostic and statistical manual. Right. So there are certain criteria that need to be met in order to say, well, you have a panic disorder. Or this was just one panic attack and it's not necessarily a disorder. And then we treat with medications. And so what we end up seeing are we can definitely find the right treatment to manage the symptoms. And sometimes patients can go 30 years without having another panic attack, or maybe even an entire lifetime without having another panic attack.
So it could be situational.
It could be, yeah. So, but once you have a panic attack, it's almost as if your body's primed for another.
You get nervous because you think everything else coming is the next panic attack.
Right. And so cured, I don't know, but certainly well managed. Yes.
It's good to hear. That's good to hear. Dr. Dapo, from the heart health perspective, how do repeated panic attacks impact cardiovascular health over time?
Yeah, so that fight or flight response that I mentioned earlier, and that increase in adrenaline and noradrenaline that occurs during a panic attack, if one experiences repeated episodes of that, what we know now out of Emory University, there was a large study that looked at chronic stress or chronic insults from a stress standpoint. And what they found was that people who suffer from chronic panic attacks have a 25 to 40% increased risk of negative cardiovascular outcomes over their lifespan. And why is that? So when you increase these stress hormones, the blood vessel tone increases. So you get narrowing of the blood vessels, hardening of the blood vessels over time. These hormones also increase inflammation, and you can check that in the blood, and you'll see inflammatory markers go up. The blood pressure goes up, the pulse goes up. This puts stress on the body and on the heart. And over time, with repeated stresses, you can end up with chronic conditions. So we see people with high blood pressure. We see people with coronary artery disease from the inflammation in the blood vessels, damaging the walls of the vessels and leading to plaque buildup. And so we see, one condition that many may be familiar with is broken heart syndrome. So this occurs when you have a sudden, huge increase in these adrenaline hormones, where the heart becomes overcome with all that adrenaline and just says, time out. And
this
stops.
Is actually a medical condition.
Yes.
This is not just I broke up with my boyfriend last week and lost 10 pounds.
Oh, that may trigger it, but yes.
But there's physiological
Yes, physiologically, and you can see it anatomically. So you can look at that person's heart, and a section of the heart just stops beating. And so they end up with, a multitude of symptoms and the constellation of symptoms that goes with that. But this highlights the connection between the brain and the heart, and how really we should be managing both conditions effectively, and we should be paying attention to both. They're both very important.
Now I see why you two work closely together.
Yes.
Dr. Rohaidy, some people feel like they get panic attacks for no reason. What are some of the reasons or factors that you see?
So we have to look at, number one is genetics. We know that about 50% genetics plays a role here. We have to look at, right, that's why a clinical interview, a thorough clinical history is important, because we need to know What were mom and dad like? Grandparents. What else is down the line that could be impacting? So genetics plays a huge role. Environment plays another role. Trauma, abuse, substance use for sure plays a huge role as well. And so you've got a lot of other factors that you have to look at. It's not just, things don't just come because they come, right? It's what we are surrounded with, how we were raised, what we're putting in our bodies. So we're looking at, sleep, we're looking at toxins, we're looking at family history, substance use, all of it, abuse history. We're looking at everything. I think everything can impact, not just, well, I've lost my job today, I've just had a bad day, right? It's everything else behind that.
That could be the straw that broke the camel's back.
Sure.
But
yeah.
There's a lot of stuff before that.
Exactly.
Dr. Dapo, the top search question, one of the things we found is, how do you cope with a panic attack? What do you do if you're having one? Well, you said go to the emergency room.
Yes.
But to get to the emergency room.
If you're having significant symptoms, go to the emergency room, especially if it's your first one or you're not sure. I think it's better to get evaluated by someone who can make that decision for you. What I instruct patients to do in my office is, really a multitude of things. When you're dealing, in the acute episode, one thing that can help a lot is box breathing. So breathing in slowly. We use a terminology called 4-6-7 breathing, I believe, or 4-7-8. You breathe in very slowly, you hold it for 7 seconds, and you exhale very slowly for 8 seconds, and you repeat that. And what that does is trigger the parasympathetic system, which counteracts this fight or flight response. And ultimately, you see the pulse come down, the blood pressure come down, and people start to feel better. Another a way to deal with it is doing 5-4-3-2-1 grounding. I won't go through what all that is, but essentially this grounds you in your environment and takes your mind off of the thing that's causing the panic. And these are things you can do in your seat, in your car, in the airplane, wherever it is that you're having the episode, and try to break it.
Yeah. No, that's very, very helpful. I do that. You focus on what's in the middle, what's in front of you, rather than everything going on around you. Dr. Rohaidy, what role, now we talked about medicine, but what role do medications play in treating panic attacks, and when do you determine if to use them?
So that's another really good question. And it's very individualized. So I can't say it's blanket treatment. But we know that first-line treatment for panic, for anxiety disorders, are medications and CBT, cognitive behavioral therapy. So with therapy and medication, with that combination, we can decrease the frequency of the panic attacks and decrease the intensity of panic attacks. And we use, some benzodiazepines in there as well, in order to kind of bridge patients starting off antidepressants, because they can take a long time to work. But there's a huge role in medications. I think a lot of us are looking more holistically now. We don't just want to follow Western medication. We want some of the natural way of treating things as well. And so there's a time and place for everything, of course. Just because you start medication doesn't mean you're on medication for the rest of your life. It means for a time in space, right? And then hopefully with therapy, we can kind of get down to the nitty gritty and find out where some of this is coming from, and learn coping skills and learn how to reframe things in our mind, learning meditation, box breathing. I think all of that combined can help people eventually get off of medication. But medication, I think, does play a big role.
Yeah. And that leads into my next question, Dr. Dapo. Lifestyle, preventative tips, exercise, nutrition, stress management, can that help reduce panic attacks?
Great question. And all of those things I would answer yes to. The things that ultimately improve cardiovascular health improve mental health. And so exercise has been shown to help a lot with reducing anxiety episodes, panic attack episodes, getting a feel for your body and your body's response kind of reduces that fear of something bad happening if you feel your pulse go up a little bit or you feel a bit flushed because you're nervous about something. So exercising 20 or 30 minutes 3 to 5 times a week has been shown to really improve anxiety. We know that nutrition plays a big role. So foods that are rich in magnesium and omega-3 fatty acids have been shown to improve anxiety. We also know that sleep hygiene is extremely important, often brushed aside, but extremely important for both heart and mental health. So getting, 7 to 8 hours of sleep and quality sleep. So looking into not just the quantity, but the quality of the sleep can help reduce stress on the heart, improve cardiovascular outcomes, and also reduce your overall stress level and improve your risk of anxiety or anxiety-related episodes.
There's also the tapping method, Dr. Rohaidy, that people say can help prevent heart attacks. Panic attacks. I'm already giving everybody a heart attack. Panic attacks.
So this is, you find certain points. I'm not an expert at this at all, but there are certain points in the body, right? These certain acupuncture points where you tap and start kind of taking your mind into what it was that you think could have brought this on, right? So it's a little exercise and also exposure therapy, also kind of CBT-ish. And so you tap, let's say, on your hand in a certain place, and you're doing your breathing and you're thinking about the issue at hand. And it doesn't have to be that, right? I've had patients tell me that they put salt on their tongue and it kind of grounds them and brings them back because they just can't get it together enough to be able to either breathe or do some of the other therapies that we kind of teach them. Holding ice in your hand as well, something kind of
shock you out of it?
Shocking, yes. So that's why the salt kind of works for this one particular patient. Ice works for some other people. And hugs. It sounds kind of silly, but holding someone, not in a bear hug, because I think that has
can make you claustrophobic.
Right, exactly. Yeah. But a tight hug to kind of bring the person in and ground you. Again, it's all about grounding.
Yeah.
Right?
No, I love this conversation. What I love about it is that you bring in all your medical expertise, but you're also looking at all these other factors that
and
can help and
teach
impact
us a lot.
And everybody's different.
Yeah, absolutely.
And what works for everyone is different.
Right. But I can't give just blanket therapy tricks and tips to everyone. My patients tell me what works for them. And then I can kind of share them and say, well, you might want to try salt or try ice or try this other thing because it's so individualized.
Yeah. But I thank you both for having this conversation today. I know this is going to help a lot of folks. Thank you, the audience, for joining us today. We love sharing this insight with all of our viewers. And for those of you watching out there, be sure to hit that subscribe button on our channel here to keep up with all the latest health and wellness information and tips from all our experts. Thank you so much for watching.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.